As the death toll continues to climb, South Africa says it's moving fast to evacuate its citizens from virus-hit Wuhan.
The interministerial team has given the planning team that's going to execute this within 7 to 10 days. They must have completed the task. This will allow for all the logistics, the contracts, the negotiations, the payments, the supply chain, whatever that needs to be done. So that's the approach.
The Interministerial Committee says while none of the returning South Africans have contracted the virus, all precautionary quarantine measures have been put in place, including having a multidisciplinary medical team on board. The chartered aircraft will perform pre- and in-flight screening.
The people that we are bringing in are South Africans who are healthy and as far as we are concerned, they are not infected. We only want to take a precaution to allow the tests to be done so that in the period during which the virus should be incubating, we should then confirm that they didn't get infected and therefore they can be released.
More than 80 sites have been inspected for the 21-day quarantine, but the exact location is still not known.
The requirements should be that there will be a perimeter line, which is outer perimeter, that will be guarded by the military. In other words, there should be no easy entrance into the site. Then it is actually considered as a no entry zone and no fly zone. So you shouldn't really be wandering into that area. It's really a precautionary issue. And those who are under quarantine will not be allowed to exit the perimeter, but will be allowed to move freely within the perimeter, although we will be discouraging group meetings.
So the focus is on the evacuation of citizens at the epicenter of the virus in Wuhan city. The Interministerial Committee says no decision has yet been taken to extend the repatriation to South Africans in other parts of the country.
We want to urge the South Africans to please make contact with DIRCO in terms of family members or South Africans that they know that are in China, in particular Wuhan city.
I think what is also important here is for us to make a call to our citizens overall, that if there's a family anywhere that has people that we are not aware of, it becomes their responsibility to get in touch with government.
And that any insinuation that the country is not ready to deal with a possible threat is incorrect.
South Africa is one of the only 2 countries in the whole continent that has got what we call a BSL 4 laboratory, Biosafety Level 4 laboratory. That's the NICD. The only other one in the whole continent is in Egypt. And those are the only laboratories that can deal with very serious pathogens, like we are talking about H1N1, Ebola, Corona, and all that.
There are currently 3 confirmed cases of the coronavirus on the continent in Egypt, Algeria and Nigeria. Chriselda Lewis, SABC News in Johannesburg.